Hello folks, welcome back. This is Kweku. I'm a pharmacist. This channel is dedicated to healthcare information as well as pharmacy stuff. So feel free to hit the subscribe button if this is something that you find interesting or useful. Today we'll be taking a look at the medication Ozempic. We will take a look at a brief description of the medication. We obviously talk about the side effects, some precautions, and then I'll talk briefly on the use of Ozempic or the connection between Ozempic and weight loss. Just a little disclaimer before we start. This video is for informational purposes only and is not intended to be a substitute for medical advice from your physician. Please continue to follow any specific instructions provided to you by your local healthcare provider or providers. Ozempic is an injectable medication which is typically used together with diet and exercise to help manage type 2 diabetes. It belongs to a class of medications called glucagon-like peptide 1 receptor agonists, or GLP-1 receptor agonists for short. They are also sometimes referred to as incretin mimetics because they mimic the action of incretin. Incretins are naturally occurring compounds in the body that when released into circulation from the gut, they help to control blood sugar by improving insulin secretion. People with type 2 diabetes will generally have a low level of circulating incretins. So medications like Ozempic mimic the actions of incretins and in the process help your body to produce more insulin to take care of your blood sugar levels. For this reason, it is not indicated for people with type 1 diabetes. It is only for people with type 2 diabetes because you really have to have your pancreas functioning to be able to produce insulin, to be able to utilize this medication. So it is not for type 1 patients. Also, this is not insulin. I've had a few instances where some of my patients that I've spoken to have gotten confused. This is not insulin. It helps your body produce more insulin, but it is in itself not insulin. There are products on the market that actually combine this medication or this class of medications with insulin. A good example that I can think about is Soliqua, where you have this class of medication in combination with insulin in a single shot. Other medications in this class include Trulicity, Victoza, Bydureon, Byetta, and recently Rybelsus, which is actually the only one that is available as a pill. All the other ones that I had mentioned come only as injectables, but Rybelsus is a new one that is available as an oral pill. With respect to dosing, it is typically given as a subcutaneous shot once a week. You normally see people start from 0.25 milligrams once weekly and then work their way up to 0.5 up to, if necessary, 1 milligram subcutaneously once a week. Now we'll shift our attention to some side effects. The number one on the list is hypoglycemia. Ozempic is noted to cause hypoglycemia in some patients. When used alone or in monotherapy, about 1.6% to 3.8% of the population experienced hypoglycemia. When used in combination therapy, that is in conjunction with other diabetic medications, that percentage rose significantly to between 6 and 30%. So it's obviously very highly recommended to keep a close eye on your blood sugar levels once you start Ozempic, more so if you take other diabetic medications. The other reported side effects are primarily gastrointestinal. Abdominal pain has been reported in about 5.7 to 11% of the population. Constipation, about 3.1% to 6%. Diarrhea, about 8.5 to 10%. Nausea, in about 11% to 20.3%. And vomiting, about 5% to 9.2%. It's worth noting that most of these side effects, these gastrointestinal side effects, were observed when there was a titration of the dose upwards. In other words, when somebody's on 0.25 and they were moving up to 0.5, these gastrointestinal side effects were noticed more. And generally speaking, once you take the dose for a couple of weeks, your body kind of adjusts. Of course, there may be some people who are never able to get over it, and therefore alternatives will be sought for them. But generally speaking, these side effects occur when one is titrating up and tends to pretty much go away once your body gets used to that relatively higher dose. Other less common side effects include flatulence, dyspepsia, gastroesophageal reflux disease, and gastritis. This is obviously not a complete list of all the side effects. Next, we're going to take a look at some precautions. And the first one is the biggest one, which is the black box warning. Ozempic and pretty much all the other medications in this class have a warning of an increased risk of thyroid C cell tumors. They found out in rodents that Ozempic causes thyroid C cell tumors. Though this has not been demonstrated in humans, it is worth noting that Ozempic is contraindicated in patients with a personal or family history of certain types of thyroid cancer, specifically the thyroid C cell tumors. I want to emphasize here that this has nothing to do with, say, somebody who takes Synthroid or somebody who takes levothyroxine. Those are completely different issues. Every so often, I get questions that people say, hey, I take Synthroid. Am I at risk? No, that is not what we're talking about. We're talking about cancer. Like if there is a personal, if you've had cancer that is in remission, thyroid cancer that is, or you know a family member that has gone through that, then you're definitely not a good candidate for this class of medications because it was demonstrated in rodents. Like I said earlier, even though it has not been demonstrated in humans, it's definitely a precaution worth taking. There's also been reports of acute and chronic pancreatitis. Pancreatitis is a condition that involves the inflammation of the pancreas, and therefore monitoring is definitely recommended. If pancreatitis is confirmed, then obviously discontinuation of the medication would definitely be a good option. So in the same way, if there's a history of pancreatitis, you want to be careful before you even start this medication to begin with. I guess this is something that you and your doctor can work through to choose the best option available in that circumstance. We've also talked already about its ability to cause hypoglycemia, especially when used in combination with other diabetic medications. Therefore, if you are diabetic and you're using Ozempic, especially with other medications, you need to be careful. You need to monitor your blood sugars closely and make sure that you are within the ranges that your doctor recommends. Depending on what your normal averages are, a dose adjustment may be necessary. And before I forget, if you are watching this in the United States, I'm going to be putting a link in the description for a link to the manufacturer's website where you can download a savings coupon to save on your copays. Now, the issue of weight loss. So Ozempic is not FDA approved for weight loss. However, several clinical studies have shown that it actually does reduce weight in people that take them. There was one clinical study where on the average, people lost about 8 to 10 pounds over a 30-week period. In another study, treatment with Ozempic resulted in weight loss of about 11 pounds in people who had diabetes and were overweight over a 12-week period. I'll put links to these studies in the description below if you are interested in taking a deeper dive into it. So in summary, Ozempic is a relatively good medication for the management of type 2 diabetes, if only you can tolerate it. It sometimes may be pricey because it's relatively new and has no generic. But like I said, I have put a coupon code in the description below if you're watching from the United States, so you can save a little bit on it. I appreciate you staying through the video. If you found it useful, please give me a thumbs up. It helps me with the YouTube algorithm. And also, if you can subscribe as well so you don't miss out on subsequent videos that I make. Thank you so much and see you on the next one.